Today, yet another vaccine maker is out with big news in the fight against the pandemic. ABC's Alex Brochet brings us up to speed.
Today, Johnson & Johnson out with new data supporting a second shot for its one-dose vaccine, potentially paving the way for a booster shot for the 14 million plus people who got that vaccine.
This is very good news. So this shows that a second shot of the J&J vaccine really substantially improves protection.
J&J saying its vaccine is still working well to prevent hospitalizations. But new data shows that 2 shots given 2 months apart resulted in 94% protection against symptomatic disease, almost identical to peak effectiveness for Moderna and Pfizer. However, earlier data finding that waiting 6 months after the first dose provided even higher antibody levels.
These data still need to be reviewed by the regulatory authorities, and the ultimate deployment of J&J boosters remains to be determined.
These findings out a day after results released for Pfizer's COVID-19 vaccine trial for 5 to 11-year-olds, finding it safe and effective in those young children. The company testing its vaccine on more than 2,200 children, giving them just a dose 1/3 of what's given to adults.
Based on, again, these preliminary results, side effects look good. Less fever, less chills than you see in that 16 to 25-year-old age range.
Now that there's a vaccine, there's a little relief.
Vaccines for 5 to 11-year-olds may be authorized as soon as the end of October. More than 1 million children infected with COVID in just the last 5 weeks. The overall death toll in the United States now surpassing the 1918 influenza pandemic.
Millions of Americans who got the Pfizer vaccine could get booster shots starting by the end of the week. That is if the FDA and CDC sign off on recommending boosters 6 months after their second shot for high priority groups. We'll keep an eye on that progress. As Pfizer pushed to get its vaccine to younger children, some of the trials took place right here in the metro. Yeah, Children's Mercy Hospital has been involved in this. Doctors there say they believe a vaccine for younger children will make a big difference, especially since now more kids are getting sick with the Delta variant.
I saw a teenager in the ICU last week who has no underlying comorbidities, no underlying medical problems in the ICU. It isn't just kids with underlying medical problems who are getting very sick.
The hospital's already gearing up for more pediatric vaccination clinics ahead of the FDA and CDC giving the green light for 5 to 11-year-olds to get their shots. Tonight in Leawood, a local church will help answer questions about the Delta variant of the virus. Starting at 7 at the Church of the Resurrection, local doctors and infectious disease experts will take questions and have answers about the variant spread. You can watch the panel discussion in person or just by going online. The White House plans to allow international visitors to come to the U.S. starting in November. All adults will have to be fully vaccinated against the coronavirus and show proof of that before they get on a plane. They also need to show a negative test within 3 days of their departure. The restrictions on non-essential ground travel through the borders with Canada and Mexico will stay in place through October 21st, we've learned. Policies do not apply to some people, including those who travel for educational or medical reasons.